Hi there, this is Mrs. Rusnak. Today I'm going to show you how to do PPE in mouth care. The first thing I'm going to do is I'm going to go ahead and use hand sanitizer, rub this all over, all the surfaces, and make sure it's dry. Then I'm going to go ahead and put my PPE on. The first thing I'm going to do is I'm going to go ahead and put my gown on. And I want to make sure that I tie this in two places, at the neck and at the waist. Okay, the next thing I'm going to do is I'm going to go ahead and I'm going to put my goggles on. And my mask. I think these go a little, these go a little longer if you need them, they adjust. And then lastly, I'm going to go ahead and put my gloves on. And I'm going to make sure that I pull these gloves, and I'm actually going to get a smaller size because these are not going to stay on my over top of my cuffs, which you want them to do. Just take the size smaller and put my gloves on. And like I said, you want to extend these over top of the cuff so that you have no skin showing and there's no gap there. I want to also make sure these have no rips or holes in them, so I want to look at those. Okay, and then I'm ready to go ahead and go into the residence room. So I'm going to knock on the door. Knock, knock. Hi, Mrs. Coerson, how are you?
Good, how are you?
Good, I'm Amy, I'm your STNA. I'm going to go ahead and do mouth care on you. Is that okay?
Yes.
All right, I'm going to make sure that she is Mrs. Coerson. I'll be right back. I'm going to go ahead and get my supplies, okay? All right, so I'm going to go ahead, and I'm still in the residence room, but I'm going to go to her bathroom, and I'm going to collect these supplies. Her emesis basin will either be in the bathroom or in her side table, so I'll have that. I'll have a toothbrush and toothpaste of hers that stays in her bathroom, and I'll have 2 cups of water. I'll have a clothing protector, and then sometimes if the resident is not conscious or for some reason maybe their gums are really sore, you might not use a toothbrush, but you might use a toothette. This is like a sponge that is impregnated with some minty, like breath freshener and that kind of thing, and you could scrub the teeth with this. But today we're going to go ahead and use a toothbrush. All right, I'm going to go ahead and I'm going to enter her room. And because this might be embarrassing, although she's in isolation, she probably won't share a room. I'm going to go ahead though and pull the privacy curtain. All right, the next thing I'm going to do is I'm going to raise her bed up, and in order to do that, to be safe, I'm going to pull this side rail. And obviously, if she wasn't already sitting up, I would sit her up. And if you have a resident that's laying flat, that is unconscious that you're doing mouth care on, you want to make sure that you turn their head to the side so that, and you don't put a lot of water or anything that in their mouth because they could aspirate that. So you raise this up to thigh-high level. All right, and I'm going to go ahead and put her clothing protector on. You do not want to call this a bib. So we'll put that on. And you're going to also use this kind of as a towel to wipe her mouth also. All right, and obviously you want to make her do as much as possible on her own. We're going to assume that she cannot brush her own teeth though. All right, so the first thing you're going to do is you're going to go ahead and dip the toothbrush into the water, and then I'm going to set that aside. And I'm going to apply a nice amount of toothpaste. All right, and I'm going to go ahead and brush her teeth. So go ahead and open up your mouth. And I'm going to go ahead and brush all surfaces of her teeth, the tops, the insides, the outsides, tops and bottoms. And I'm going to do the upper ones the same way. Try not to press too hard because remember their skin is fragile when they're elderly. And also very important, you want to go ahead and brush their tongue. So go ahead and stick your tongue out. Try not to gag them. Okay? And then I'm going to go ahead and set this toothbrush aside. I'm then going to give her some water to rinse. Here's some water. Swish that around. Go ahead and spit. Okay, and then she's probably going to want her towel to wipe off her mouth. I'm going to give her some more water. And obviously, if she can hold this herself, she would do that. Okay, how's that feel?
Good.
Good. All right, I'm going to set this aside. Then I'm going to go ahead and take off her clothing protector. This goes into the linen hamper. And then I'm going to go ahead and put her bed down. And I'm going to go into her bathroom. I'll still be in isolation. And I'll take all of this equipment and all of this stuff over there and clean it out. Okay, I'll be right back, okay? I'm going to rinse this out. Okay, I'm going to just dump the water into that emesis basin, and then I can go ahead and throw this in the garbage. And then I can take her toothbrush and the emesis basin over to her sink in her bathroom in her room. I'm going to dump this out into the sink. I'm going to rinse out her toothbrush. Make sure you rinse this out well. Not a bad idea to probably take a paper towel, lay this on the counter. Once I rinse her toothbrush out, I can lay it on that paper towel. I'm going to take some cleaner, disinfectant or soap. I'm going to clean out this emesis basin. And depending on your facility's policy, I'm going to use disinfectant on it. So I'm going to wash, rinse, and dry this and disinfect it. And students, you really do want to clean this well because with all the viruses and stuff going around and germs and stuff, you know, the person that you're brushing their teeth, you are actually putting their sputum in here. So you want to go ahead and make sure you really do get this clean. Shut the water off. Then I'm going to take my supplies back to the residence room. This goes in the trash can. All right, and I'm going to put away all my supplies. All right, and this goes into the linen hamper. It's in the trash. Okay. This back. Mrs. Coerson, is there anything else I can get for you?
No.
Okay, here's your call light. Make sure you give her call light. And I'm going to go ahead and make sure the bed is down, which it already should be. I'm going to go ahead and put the bed rail down. All right, do you want to sit up or lay back?
I'll sit up.
Okay, and then before I leave the room, I want to go ahead and pull back the privacy drape. All right, if you need anything, you just give us a call, okay? All right, have a good day. Then I'm going to go ahead and I'm still in the room and I'm going to go ahead and take my PPE off, okay? The first thing I'm going to go ahead and do is take my gloves off. This goes in the trash can. I'm going to go ahead and take my goggles off and put that in a designated container. I'm going to go ahead and take my gown off. And you're going to roll this, take it from the inside, you're going to roll it inside out, kind of roll it on top of its own, on the outside. Okay, I'm going to put this in the trash can, and then the last thing I'm going to do is I'm going to take off my mask, put that in the trash, and then the very last thing is I'm going to go ahead and sanitize my hands. Thank you.